Hello, this is Lee, licensed acupuncturist and herbalist. This is Mr. Springer, and he is our hero. He joined World War II, and now this year, in May, he turned 91 years old. Is that right?
That is correct.
Yeah. So I want to talk about his, because he's still walking without cane and without knee pain. He had a knee surgery on which side?
It's on the right knee.
Yeah, it's the right knee. He had a knee surgery at the age of 85, I think.
Well, it was about 8.5 years ago.
8.5 years ago, and he had a lot of swelling after the surgery. But you did a lot of exercises, right, afterwards?
I started, and I'm still doing a lot of exercises for it. Yes, 4 days a week.
4 days a week.
Mm-hmm.
And initially, his knee has a lot of swelling and couldn't straighten up, but he was doing acupuncture once a month, and he also continued exercise. And there's one point they kind of using manipulation to straighten out your knee.
That was only about a month after I had the surgery.
Mm-hmm.
The surgeon was concerned that I wasn't able to bend the knee enough.
Mm-hmm.
So he put me back in the operating room under sedation, of course, and he bent it forcibly. And so maybe that helped a little, I don't know.
Yes, but I think exercise like 4 times a week,
Yeah,
right?
the exercise I think is the most important thing because I'm concentrating in the exercise on my knee as well as on my heart.
Yes.
I do bicycling for 17 minutes so that I get the motion in the knee.
Okay.
And then I lift the knee up with weights on my ankles, the leg straight out, to work the muscles here. And the last thing I do is to straighten the leg out on another chair with weights here to straighten it out. So I keep working on that knee 4 times a week.
Do you do any cardiovascular?
Well, the cardiovascular is really tied up in that same bicycle activity for 17 minutes. I go at a very strong pace so that I can help my heart as well.
Yeah.
It brings the heartbeat up, and I know I'm working hard at it.
Yeah. And at the age of 91, he had AFib before. He's only on 2 medications. I think one of them is for blood pressure and one for the AFib.
That's correct.
And you also take the baby aspirin, and only 3 medications. And now you stopped the blood thinner many years ago, right? You took the blood thinner, Coumadin.
Oh, yes.
Yeah.
I stopped, my cardiologist stopped the Coumadin about, maybe 5-6 years ago and substituted 1 aspirin a day for that. And I'm very happy. It's not much fun taking Coumadin.
Yeah, and he's the only one person in the cardiologist list who started Coumadin but stopped the Coumadin. So his exercise and diet and cut down the coffee, right?
Of course.
He used to be a pilot, and then you flew how many years?
About 25 years.
25 years, and he never had a panic attack, right?
Oh, no, I wouldn't allow it.
Yeah, and one time you had remember?
Oh, I remember it well, and that was the time not to panic because I'd be dead today if I had.
Yeah, and then that time, before he started flying, he said he didn't drink coffee. Did you?
I don't remember when I started. I really don't.
So the body changes. Initially, he drank coffee, and then the heart rate become irregular. But for the past couple of years, he changed to decaf, and now you change back to regular coffee, right?
That is correct.
Yeah, but then he only drink 1 cup.
1 cup in the morning, and that's it.
That's it. So with the food, it's not with empty stomach.
No, it's with breakfast.
With breakfast, yeah. So whatever you did is the correct thing to do because you don't have cane, you can walk, and you don't have knee pain, you can climb the stairs, right?
That is correct, yep.
So exercise and acupuncture and also good diet and willing to change your habit will help you to stay healthy and after knee surgery recover completely. How about the other knee? Is it good?
This knee never had any surgery, and it never needed it, and it seems to be fine right now.
Yep. So if you do have AFib, and then Mr. Shriner Robert will give you the example that you can change your habit and make your heart stronger.
And there's one other thing, if I may add it, and that's a mental attitude. I will not allow myself to get old. I keep my mind extremely active, and I say I have to give to what the body doesn't want me to do, but I'm going to fight it all the way. So it's an attitude. I have a young attitude in an old body.
Yeah, but then also I knew you're singing, right? You joined a singing group.
I did. I haven't done that for a few years. When you get my age, your voice isn't as good as it used to be.
Yeah, the singing is very good for increase your lung capacity. And you never depressed, right?
Correct.
Yeah, you never had a panic attack or depressed, and even he flew jet. Is that jet?
I flew jet fighters and I flew propeller transports, both.
Yeah, for 25 years.
Right.
And that's amazing. So we all need to learn from you.
I lived through it. That's the important thing.
Thank you.
You're welcome.